So what are different presentations possible?
So the presentations of typical cardiac pain, okay. If it is a cardiac pain, always I want to emphasize on this that the patient will never stay at home. He has to come to the hospital.
Correct.
So this is the number one point which I would like to emphasize, that the patient will always come to a hospital with that pain. And a cardiac chest pain, a patient can never pinpoint. It is always a diffuse pain. He will hold a fist and then he will point. It's a diffuse type of pain. Okay. And there may or may not be radiation. And radiation of that pain will be generally to the medial aspect or the inner aspect of the arm. And also it can radiate to the jaw, to the back, and also to the back of the chest. Yes. And regarding the pain, many of the people come with chest pain along with vomiting. Sometimes patients only come with vomiting. We do an ECG, it is maybe an inferior wall MI.
Acha.
So generally, the pain of the heart, involving the heart, is generally above the epigastrium. Above the umbilicus, we say. Below the umbilicus, generally not considered as cardiac pain. So these are the few telltale signs of cardiac chest pain.
So